Thank you so much. Lovely to be here with you this morning. So I was asked to share a little bit about the work we've been doing here in BC and present to you a potential model, a bit of a blueprint that is useful in thinking about advancing a national strategy for pain. So I'm going to talk a little bit about the why, a little bit about the what, and a little bit about the how. I think you all know that chronic pain is a very significant issue. It has tremendous impacts on individuals, impacts on the healthcare system, and impacts on society. So I know when I'm in a room with you folks, the greatest scientific minds in Canada, that I don't need to belabor the statistics. What I want to take you on is a bit of a journey to understand the impact on people who live with chronic pain. As Pat was mentioning this morning, for people living with chronic pain, it's not a headache that goes away. It's not a toothache that's sore for a few days and then diminishes. We're talking about pain that persists. And I'm going to ask you to just bear with me and suspend your analytical mind and call on your imagination as we think about what that is like. Because really, this is the thing that grounds our organization. It's our mission. It's the thing that we are always attentive to. Some of you who have worked in the area of engaging patients know the phrase, nothing about me without me, and that is really the cornerstone of what we are about. So in the work that you hear about today and in the work that I'm hoping you carry forward, I want you to be thinking about the burden of this issue on the healthcare system. I want you to think about the tremendous impacts on society, but I also want you to stay connected to the journey that I'm going to talk about now. So imagine that you are somebody who has had a surgery, a garden variety surgery. Imagine you're somebody who has fallen off your bicycle and been injured. Imagine that you're somebody, a nurse, who's lifted a patient and hurt your back. Imagine that you are someone who has an experience of trauma that has excited your nervous system at a young age and potentially predisposed you to a risk of chronic pain. So imagine that this pain begins and you're thinking, well, this will be over soon. You take a few Advil, you ice, you go to your chiropractor. But as time goes on, this pain is persisting. You start to miss your friends because you can't do all the things that you used to do. You start to feel isolated. You are talking to people in your family. You're talking to your coworkers. And people are thinking, this person looks fine. What's the problem? I'd like to have a holiday too. I'd like to be off work as well. And you see that no one believes you. You start to feel angry and invalidated. Along this journey, you are sure you're going to get back to your old self. And you think, this can't be happening to me. You talk to your physician or your physiotherapist that tell you, you're not doing enough. You're sleeping too much. You're being too sedentary. That's why you're not getting better. You feel demotivated. You can't do anything right. You start to feel more and more anxious. Is there no one that's going to help you? People start to tell you that it's all in your head because they can't see anything. They've done all these tests and you look fine. Eventually, your physician starts to feel hopeless and tells you there's nothing more that he or she can do for you, but they're going to put you on a wait list for a pain clinic, and you can expect to get a call in 3 years. This is true, and Fiona knows, right? you start to feel your life unravel. People want to play soccer with their kids. They need to go to the grocery store and be able to carry those groceries from the store to their car. They start to feel sleepless. They can't get to sleep at night, and that exacerbates their pain. This is the journey. And we often call it a pain spiral, which kind of implies, you're circling the drain. Excuse me. But what we know from the lived experience of chronic pain is it is this kind of overwhelming, circuitous, back and forth journey between despair and hope, between help and hindering. And this is the thing that takes a tremendous toll on the 1 in 5 Canadians that live with this condition. The impacts that people experience are tremendous. People's lives are affected, their jobs are affected, their families are affected, people's ability to work. When you think about this issue and you start to draw the lines, there's a connection to poverty, there's a connection to homelessness, there's a connection to workforce and productivity in our economy. I think for many of you, if you took 5 minutes to say, where does this go, you'd see that there's a connection to virtually every major social issue in Canada. When people in pain go to access services in our health system, this is what it looks like. When we show these slides, people always say to me, this is so overwhelming. This makes no sense to me. How can people be living with this? And that is the lives of people who are living with chronic pain. In the blue bubbles, you see the thoughts of physicians and other healthcare providers that are working with these patients. And what we know is that hopelessness and helplessness is not just an experience for people who live with pain, it's an experience for their healthcare providers as they struggle to find solutions, as they try and refer people to programs that have wait lists, as they tell people that what would help them are services like physiotherapy, psychological support that they know their patients cannot afford and are not available in their communities. So the toll of this condition is not just felt on the individual, it is felt on healthcare providers who want to make a difference. So this really is the why for the existence of our organization. Pain BC was started by a group of interdisciplinary healthcare providers, some of whom had their own personal experience of chronic pain, and they saw that the system was broken for these patients. They saw that these patients are some of the most challenging that they or their colleagues ever see, and they felt that something needed to change. So our mission has really been to improve the lives of people who live with pain in our province and transform the way that pain is understood and treated. Pain BC has operated with an integrated, broad set of strategic priorities. So we recognize that it's not just enough to treat pain, we need to prevent pain, and where we cannot prevent pain, we need to intervene early to prevent that spiral that I was talking about. If people have early intervention, the depression, the comorbidities, many of those things can be prevented, and we have many strategies that are aimed at that. We also have a focus on kids who live with pain, because as you're going to hear about today from Fiona and Katie and Carly, chronic pain does not just affect adults, it doesn't just affect seniors. There are numbers of kids in Canada who are living with pain and who need support now to prevent a lifetime of disability. We have a really strong focus on empowering people who live with pain, on building hope and confidence for those people, giving them support, mobilizing them as a political force in our province. There really has not been a banner for people who live with pain. People identify as, I have arthritis, I've lived with cancer, I have heart disease. But what about all the people who were in a motor vehicle accident, people who have workplace injuries, people who were playing tennis with their kid, injured themselves, and have no banner under which to identify? I mean, even for people who live with diseases like arthritis and heart disease, for many of them, their disease is well managed and their pain is not. So our organization is really intended to give a home for people whose lives are impacted by pain regardless of its origin. We know that healthcare providers have had traditionally very little education in treating chronic pain or assessing it. There was a seminal paper published a decade ago that had done a very thorough assessment of the curricula in all Canadian universities and found that veterinary students in Canada were receiving 2 to 5 times the education on pain than any health science students in our universities. So medicine, nursing, pharmacy, dentistry. So that's why when you're taking your cat or dog to the vet, nobody's saying, we think they're drug seeking or they're making this up. Those vets are receiving more education. And we know that that's changed a bit, but it has not changed completely. We know that there are systemic issues, so big system barriers to treating chronic pain. Everything from a lack of fee codes in our healthcare system, lack of diagnostic codes that can track chronic pain and give us good data, lack of policies, regulatory issues. So this has also been a big focus for our organization, trying to tackle those. As you know, chronic pain is an invalidated and stigmatized condition. Thinking back 30 or 40 years to how we thought about mental health, mental health was very much in the shadows at that time. Chronic pain is just emerging from the shadows, and we have a lot of work to do to raise awareness of this condition and its impacts. Lastly, our last strategic priority is around fostering pain research. So while we're not a funder for research, we are certainly an advocate with funding bodies to devote more of their resources to the issue of chronic pain. Last year, with a number of our BC institutions, we created the BC Pain Research Network. We now have over 100 pain researchers from many different disciplines, from philosophy to anesthesiology, in our province, coming together to do education, to collaborate on new research, and to inform policy change. So when you look at these strategic priorities and think about what relevance does this have for a national conversation, these are really the major buckets that need to drive change in all of these different domains. So our organization is what we call a collective impact organization. So we have over 100 partners, from our medical association to local community groups to our Ministry of Health to the College of Pharmacists and many, many others who work with us. This is an intractable social issue. You cannot deal with intractable social issues on your own. So our model is really about developing partners, finding those partners, doing some needs analysis, what needs to be done and by whom, conceptualizing initiatives, moving forward on implementation and delivery, and then as we're going, evaluating those, and then spreading and scaling up initiatives that are successful. So we've done this on a small scale in a local community in a remote part of our province, where we've developed something, tested it, and it's now being spread provincially. And I'll talk a bit about our provincial strategy, because this is sort of a macro example of this model. Our organization's role in this collective impact approach is really the backbone support. And advancing any large-scale change initiative, you need an organization that's going to keep the vision, that's going to bring people together, and is going to provide strategic expertise, backbone support. That means communication support, project management support, evaluation support, and really help this broad group of stakeholders to drive change and not just be sitting and talking. So we really formed our organization a decade ago and got going on a number of initiatives across our province. So these are things like practice change initiatives for family doctors, patient supports, all of those kinds of things. But we have been driving towards a provincial strategy for chronic pain, where we would really get buy-in from our provincial government around the big system issues, where we would see funding flow to the necessary kinds of enhancements in our healthcare system, where we would see a focus on research, where we would see a focus on data and surveillance. In February of 2017, we brought together over 200 stakeholders. So these were people who live with pain, clinicians, policymakers, leaders from virtually every large healthcare organization in our province for our Provincial Pain Summit. At that summit, our provincial minister stood up and committed to lay the tracks for a provincial strategy for pain and provided funding to our organization to really do that collective impact work, so bring everybody together. At the summit, people stood and made declarations. They heard what the issues were, they heard what the priorities were, and they committed to take action with our support. So, where have we gone? We have this, back. So we've been moving forward with a number of working groups with about 120 representatives from these various organizations, working on specific initiatives that are really foundational bricks in the foundation of the provincial strategy. At the same time, we have been working with our provincial government to draft this strategy and take it out for consultation. So for those of you who follow BC politics, you'll remember we had our summit in February. We had a provincial election in May that was frankly not a decisive victory for our current government. It was a close election. There was some uncertainty. So any of you who have worked in political advocacy know that without political certainty, it's very hard to move agendas forward. So it took some time to really advance this with our provincial government. We had a new ministry, the Ministry for Mental Health and Addictions, which hadn't existed prior to this time, and that created a bit of churn in the system. It took until December for the Ministry of Health and the Ministry for Mental Health and Addictions to really decide who is leading the chronic pain file. That was decided, and since then we've had, I would say, in the bureaucracy of government, warp speed action on this file. By April, we had a draft provincial strategy, and that strategy has been going out for consultation to virtually every major healthcare stakeholder over the summer. So where is this going? I was hoping that our provincial minister may be here today to announce the strategy, but we're not quite there yet. So we're still in draft form, but I can give you a sneak peek at the big buckets that the strategy is going to entail and the vision. What we really want provincially is that people who have chronic pain have improved quality of life. So we're not just talking about a reduction in pain, we're talking about improved quality of life, improved function. And we want to minimize the burden of chronic pain on them, on society, and on caregivers. So the big buckets, we're really talking about a stepped care model of new services, starting with primary care, the secondary level of the system, up to that tertiary, really specialized level of care, and of course the prevention piece is at the foundation of that. Education, training, guidance, and support for clinicians and patients, and then really improving the work that we do to collect better data, to get the right codes in place, and really be basing our future decisions on better information. We know that the opioid crisis has really driven action on this issue. And that's been, frankly, a positive thing for our organization and the people that we represent. There have been unintended consequences of this issue and of the government and other stakeholders' response. So we have seen increased stigmatization of people who live with chronic pain. And I'm talking about stigmatization that people who live with pain will tell you, I can't go to my pharmacy to fill my prescription for opioids because I'm afraid the pharmacist will think I'm an addict. I opened my purse at work and someone saw that I had opioids in my purse, and now they have a negative impression of me. So these issues have become conflated, and we're seeing negative impacts on people. We're seeing barriers to access services, and we're seeing concrete harms, as many people who have been on long-term opioid therapy are aggressively weaned or cut off their medications, and some of them turn to the illicit drug supply to cope. I'm almost done, Kate. So there's tremendous national momentum. This meeting is part of that. We have seen in 2016, CIHR convened a pain research summit, bringing people together to really look at how can we do better? How should we be allocating our resources to this pressing need that really has gone under-recognized up until recently? In 2017, there was a McMaster Health Forum looking at this issue, looking at the need for a national strategy and how we get there. In 2018, just last week, we had a federal opioid symposium. For the first time, the chronic pain community was invited and had a very strong presence there, talking about the impact of the overdose response and opioid response on people with pain and what we need to do about that. The federal minister said from the podium, we are looking at a Canadian pain task force. So your timing, I don't know if you somehow had a crystal ball, but the fact that this event is happening the week following, very appropriate. We're not the only provincial effort underway. We're the most robust, but there are efforts underway in Alberta to develop a strategy, efforts in Saskatchewan, efforts in Ontario. The CIHR SPORE Network for Pain was funded in 2016. So there's huge momentum. And I would say to you that I think we're almost at the tipping point, and I'm hoping that your efforts are going to help us get over that top. So the call to action for you is, I know many of you in this room are influencers, not just within your own institutions, your own areas of expertise, but with your provincial policymakers, with federal policymakers, and I'm hoping today is going to spark in you a passion to drive this agenda forward and to transform the way that pain is understood and treated for the 1 in 5 Canadians who live with it and suffer its impacts. Thank you very much.